right, welcome to the Deep Dive. Today, we are going to dig into something that I think is probably going to resonate with a lot of you out there, something that you might have personally experienced or know someone who has, and that is root canal treatment.
Ooh, root canals.
Yeah, exactly. And more specifically, we're going to be talking about whether it's better to get the whole root canal done in one appointment, a single visit treatment, or spread it out over multiple visits.
Right.
So our goal here is to, as always, is to kind of get you up to speed quickly and thoroughly about what the science actually says.
Yeah, absolutely. And to sort of wade through this, we've got a great piece of research to look at.
Right.
A systematic review and meta-analysis that was published in BMJ Open.
Mm.
Now, a systematic review and meta-analysis is kind of like the top tier of research.
Right.
Where researchers take a look at all of the available evidence that they can find on a topic.
Yep.
And they try to combine it in a way that helps us understand the overall picture.
Yeah, and what's cool about these meta-analyses is they don't just look at one study.
They're looking at a whole bunch of studies.
Yeah, exactly. In this case, 29 trials involving over 4,000 patients.
Oh, wow.
So a very large number of people in the studies that were then combined for this analysis.
So that's a pretty substantial amount of data.
It is.
So what were these researchers looking at when they were, sifting through all this data?
Well, they were trying to see if there was a real difference in the likelihood of complications depending on whether you have a single visit or multiple visit root canal.
Oh, that makes sense, yeah. So you're listening out there. Our mission for this deep dive today is to figure out, based on this, huge chunk of research, whether one of these approaches actually has an edge when we consider, I guess, the things that matter most to people, right? Which are long-term problems, pain levels, and those really unwelcome flare-ups.
Right.
Okay, so let's get right to it. First up, when we're talking about problems that might pop up, let's say, a year or more after the treatment, what did this review actually uncover? Well, what's interesting is when they looked at 10 different studies with over 1,200 teeth and followed these patients for an average of about 2.5 years.
Okay.
They didn't find any statistically significant difference in the likelihood of long-term issues between single visit and multiple visit groups.
Huh.
Now, these issues include things like ongoing pain, interference coming back, or something called periapical lesions, which are these little pockets of irritation or infection that can form near the root of the tooth.
Right.
But basically what they found was that the risk was very similar in both of those scenarios.
Okay, so bottom line there for you listening is that when we look at really the long-term success of root canal, it seems like, based on this study, it doesn't really matter, or it hasn't made a noticeable difference so far, whether you do it in one go or you spread it out. So for those trials that they looked at for long-term complications, did they all kind of do the multiple visit treatments in the same way?
Well, that's a really important detail, yes. In all 10 of those trials, the patients who had multiple visits, they had calcium hydroxide placed inside their tooth as a medication between appointments.
Oh, okay.
Calcium hydroxide is a very common type of antibacterial, and it's something that dentists use frequently in these multiple visit scenarios.
Got it. So for those long-term outcomes, when multiple visits involve calcium hydroxide, it's basically in the same ballpark as getting it all done at once?
Seems to be.
Seems to be, but there's always a catch, right? What did the researchers have to say about how strong this evidence is?
Well, this raises a really important point, right, about how much can we really rely on these long-term findings. The researchers themselves labeled the evidence as weak.
Weak, huh? Yeah.
Yeah, and there's a couple of main reasons for that. One is that a lot of the individual studies had what we call a high risk of bias. That's just a fancy way of saying there were issues with how they were run, potentially influencing the results. And then the second reason is that there just weren't a huge number of these long-term complications reported overall.
Gotcha.
Making the results less precise.
So we can't really take this as the final word then?
Yeah, exactly. It's suggestive, but not conclusive.
What about if someone's tooth was in kind of bad shape to begin with? Like, if it was already hurting, did that change those long-term odds?
So they did look into that in their analysis, and what they found is that the initial condition of the tooth, so whether it was painful, whether the nerve inside was still alive, or if there was already one of those periapical lesions present,
right,
those things didn't seem to significantly change the long-term outcomes.
Okay.
Regardless of whether it was a single or multiple visit.
Okay, so even if you're starting off with a troublesome tooth, long-term success seems pretty similar no matter how many visits you have.
Yeah.
Now, they mentioned something called trial sequential analysis, or TSA. What is that all about, and what did it tell us about these long-term complications?
Yeah, so TSA is a really interesting statistical tool. And it's used to essentially check if we've actually looked at enough data to really trust the results that we're seeing.
Gotcha.
We don't want to jump to conclusions too early.
Right.
And in this case, for long-term complications, what the TSA showed is that we haven't gathered enough solid evidence yet. We can't definitively say whether one treatment is better or worse or the same as the other.
Okay.
The number of patients that have been studied so far is still too low to give us a really firm answer.
So long term, it's still kind of an open question. Let's switch gears to something a little bit more immediate and something that I know a lot of people are concerned about when it comes to root canals, and that is the pain that you might feel right after the procedure. What did this review find about short-term pain levels?
Well, when they looked at 20 studies involving over 3,000 teeth this time, and they focused on the pain levels that were recorded about 2 days after the treatment, they also didn't find a statistically significant difference in the risk of short-term pain between single-visit and multiple-visit root canals. So the risk, again, very similar for both approaches.
Another tie in terms of the immediate pain risk. So I guess that's somewhat good news.
I suppose so.
Now, were these pain levels checked after the whole root canal was finished, or were they checking it at different points along the way?
Well, that's an interesting question. Most of the studies measured pain after what's called obturation, which is that final step where they fill the root canal system.
Right.
However, it is worth noting that some studies only looked at pain after the initial cleaning and shaping of the canals, not after the final filling, at least in that multiple visit group.
Yeah, that makes sense.
But the main analysis did focus on pain after the entire root canal was completed.
And how about this short-term pain finding? Was the evidence a little bit stronger than for the long-term stuff?
It was rated as moderate,
Okay.
which is a step up from weak.
So it's a little better.
This was mainly because they had data from a much larger number of patients for short-term pain than they did for long-term complications.
Makes sense.
But again, just like with those long-term studies, many of the individual studies still had issues with how they were conducted, which limits our confidence a bit.
Moderate evidence of no difference in short-term pain. It feels a bit more reassuring. What about those initial tooth problems that we talked about earlier? Like if there was pain already, or the condition of the nerve, or those lesions, did any of that have an impact on how much short-term pain people had?
Interestingly, no. Just like with the long-term complications, the subgroup analysis didn't find that those initial conditions significantly affected the risk of short-term pain in either the single-visit or multiple-visit groups.
Okay.
And interestingly enough, whether they used that calcium hydroxide medication between visits also didn't seem to make a difference in short-term pain levels.
So it's all pretty consistent so far.
Yeah.
Now, what about the trial sequential analysis? What did that tell us about the short-term pain data?
Well, the TSA for short-term pain showed something interesting. Well, it looked like at one point there was a potential benefit for one treatment or the other. When they adjusted for essentially looking at the data as it was accumulating, that suggestion went away.
Oh, wow.
Meaning that the initial trend might have just been a random fluke because they didn't have enough data yet.
Okay.
So the adjusted threshold, what we call the trial sequential monitoring boundary, wasn't crossed. And that means we still need more research to have really solid evidence about short-term pain. So even though right now the data suggests there's no difference,
Right.
future studies could potentially change that.
Okay.
It's not a done deal.
Gotcha. So let's get to the one that I think worries people the most, and that is those short-term flare-ups.
Yeah, nobody wants one of those.
No, they sound terrible.
Yeah.
So what did this review find about those sudden and, nasty episodes of pain and swelling?
Well, this is where we see an actual difference in the findings. When they look at 8 studies with just over 1,100 teeth, they found that there was a significantly higher chance of a flare-up after a single-visit root canal compared to a multiple-visit one. The risk was more than twice as high in that single-visit group.
Wow. Okay, so that sounds like a pretty substantial difference. So does that mean that getting it done in one go might make you more prone to having some serious pain shortly after?
Well, that's what the initial analysis would suggest.
Okay.
But, and this is a big but, we really have to scrutinize the quality of this evidence. The researchers labeled the evidence for this outcome as very weak.
Very weak.
Very weak.
Okay, why such low confidence when the finding seems so significant?
Well, there's several reasons. First, just like with the other outcomes, most of the studies in this analysis had a high risk of bias.
Right. We've heard that one before.
Yeah, it's a common thing.
Yeah.
Second, the results varied quite a bit across the different studies, so the findings are less precise.
Okay.
And third, there was evidence of potential publication bias, which means that studies that didn't find a difference, or maybe even found that multiple visits were better, might not have been published.
Oh, I see.
So the evidence that we have access to might not represent the whole picture.
It might be a little skewed.
Exactly.
So this, what sounds like a really important finding, might not actually be as reliable as it sounds.
That's exactly right. And what's interesting is that when they actually dug a little deeper and looked at the individual studies, they found that one study in particular reported a really high number of flare-ups in the single visit group. And this one study really skewed the results.
Oh, wow.
When they took that single study out of the analysis, the significant difference between the two treatment approaches disappeared completely.
So one unusual study might be kind of throwing off the whole picture here.
It really does highlight the importance of looking at the details of individual studies and not just focusing on the overall results of a meta-analysis.
Right. So we can't always take things at face value.
No.
Now, what about those initial tooth problems or the medication used between visits? Did any of that seem to make a difference in the risk of flare-ups?
They looked into that as well, and they didn't really find any of those factors to be significant predictors of flare-ups. But we have to remember that this analysis was based on a very small number of studies that actually reported on flare-ups to begin with.
Right.
So it's really hard to say for sure.
Okay, so small sample size, again, making it tough to draw any firm conclusions.
Exactly.
And what did that trial sequential analysis tell us about the flare-up data?
So similar to the short-term pain findings, the TSA for flare-ups showed that while the data seemed to cross that statistical threshold, indicating that single visit was worse.
Okay,
When they adjusted for the accumulating data, that threshold was no longer crossed.
I see.
Again, suggesting that the initial significant finding might have just been due to chance, not having enough data yet. And in fact, because there was so little data overall, they couldn't even calculate something called the futility boundaries, which would tell us if more research is unlikely to change the conclusion.
Okay, so basically, this higher risk of flare-ups with the single visit treatment, even though it sounds scary, is based on some pretty shaky ground and might not actually hold up with more research.
Right. More research is definitely needed.
Okay, so we've covered the long-term stuff, the short-term pain, and the dreaded flare-ups. What are the main conclusions that we can take away from this deep dive into the research?
Well, the biggest takeaway, I think, is that based on the evidence that we have right now, there's still a lot of uncertainty. We can't say for sure whether getting a single visit or a multiple visit root canal is going to lead to significantly different outcomes overall.
So it's really kind of a toss-up based on the current data.
Yeah, more or less.
But what about that, even though it's based on weak evidence, that hint of an increased risk of flare-ups with the single visit approach, is that something that you think dentists and patients should be paying attention to?
It is something to keep in mind. And because of that signal, even though the evidence is weak, the researchers actually pointed out that multiple visit treatment might be a better option in certain situations. For example, when treating teeth that already have those periapical lesions that we discussed earlier. So it's a judgment call that your dentist would help you make based on the, less than perfect evidence that we have.
So not a hard and fast rule, but maybe a slight leaning in some cases?
Right.
So what needs to happen to get us some clearer answers on all of this?
Well, really what we need is future research that is really well designed, high quality, and carefully conducted. That means making sure that patients are randomly assigned to receive either single visit or multiple visit treatment.
Okay.
It means ensuring that the people who are actually assessing the outcomes don't know which treatment the patient had. And really importantly, it means that the studies are described in enough detail so that we can really understand what they did and how they did it.
Yeah.
We also need longer follow-up periods
Right.
to truly capture those long-term issues.
Yeah, that makes sense.
And we need standardized outcome measures, which basically means everyone needs to measure outcomes in the same way.
So we're comparing apples to apples. Now, were there any other limitations in the studies that they looked at that you think are worth mentioning for our listeners out there?
Yeah, there are a few.
Right.
One is that a lot of these studies were what we call controlled trials, which, as the name suggests, they're conducted in a controlled environment,
Right.
which might not perfectly reflect what happens in a real-world dental practice.
Yeah, for sure. Yeah.
Also, for those long-term complications, they often kind of lumped different types of problems together, which can make it harder to pinpoint what's really driving the results. And as we discussed, the way pain was measured and how that data was combined across studies didn't always take into account the severity of the pain. So someone might have reported having pain, but was it mild, moderate, or severe? That kind of detail wasn't always included.
Yeah, so lots of little details that I guess can be difficult to capture in a big review like this.
Right.
Okay, so let's wrap things up here for everyone who's listening. What are the most important things to remember from this deep dive into the single visit versus multiple visit root canal debate?
Well, I think the key takeaway is that the current research doesn't show a clear advantage for either approach when we look at long-term success or even short-term pain.
Okay.
However, and I know we've said this a few times,
Yeah.
but that suggestion, even though it's based on weak evidence, that single visit treatment might be associated with a slightly higher risk of a flare-up in the short term. That's something to keep in mind and to discuss with your dentist.
So no clear winner based on the current science, but I think some important things to consider and to discuss. Ultimately, what should our listeners keep in mind when they're facing that decision about their own root canal treatment?
You know, this is a complex area of dentistry.
Yeah.
And the best approach really isn't the same for everyone. It depends on the specific tooth that needs treatment, your own individual health situation, and medical history.
Right.
And of course, your dentist's professional judgment.
Right.
So this research gives us some valuable insights, but the final decision should always be made with a good conversation between you and your dentist.
Absolutely. I think that's key here, is making sure you have a conversation with your dentist and that you're both on the same page about the best way to proceed.
Yeah.
So here's something to think about. Given that there are still some unknowns here and that there is this hint of more immediate discomfort with those single visit treatments, what's more important to you? Is it minimizing the number of trips to the dentist, or is it potentially lowering that risk of a painful flare-up right after the procedure?
Yeah, that's a tough one.
It is a tough one. And even thinking about, dental techniques and materials are always evolving. How might future research change what we think is the optimal way to do a root canal? So some food for thought. Thanks for taking this deep dive with us.
Thanks for having me.
We'll see you next time.
See you later.